There are many centers that may not see a single esophageal cancer case in a year. At Weill Cornell Medicine, New York-Presbyterian, we are in the top 1% of centers treating esophageal cancer.
Our immersion in trying to find new surgical approaches for the treatment of esophageal cancer is the reason why we've become a referral site for a lot of the complicated, often patients who've been operated on multiple times before for benign disease or for esophageal cancer.
New York-Presbyterian Weill Cornell Medicine has been the leader in esophageal cancer treatment for many decades. Our techniques that were developed here have been adopted worldwide, and this allows for the patients really to have a great recovery. We pride ourselves on our technical ability, on the way that the patients recover, and how quickly they're able to resume their normal life.
Esophageal cancer is an incredibly rare tumor. We are fortunate enough here to have some of the leading investigators and scientists studying esophageal cancer, which affords us the opportunity to offer the most innovative technologies in the diagnosis and the treatment of esophageal cancer. The data is pretty clear that with this rare tumor, being at a center that has high volumes of esophageal cancer patients really improves their outcome.
It's not a just cut the tumor and put it back together again. That's about a 5-6 hour operation, but we've done a lot of it. And that's one operation where doing a lot means a lot, because you know where all the problems may be, and therefore you are able to either prevent them completely or you deal with them early. That's a critical part that comes only from being in a place that has an entire team dedicated to your care, not one specialty by itself.
What I tell a patient with newly diagnosed esophageal cancer is that they're not alone. Basically, there's a team of experts behind you that will take care of you from a preoperative to an operative to a postoperative state. And this really allows the patient to feel at ease and really kind of explains the treatment as well as explains the recovery process.
There's no doubt that surgery for esophageal cancer is complicated. It not only removes the area of the esophagus where the cancer is with a good safety margin on both sides, it rearranges the plumbing of your gastrointestinal tract. Recovery entails preventing all the complications while you're in the hospital. There's a whole different part of esophageal surgery outside of the cancer sphere that's called surgery for benign disease. I want to say one of the very few places in the state where we have a benign esophageal group. And that means surgeons, gastroenterologists, endoscopists, radiologists, and pathologists. And we study in great detail all the patients that come to see us with esophageal problems.
At New York-Presbyterian, we have the most innovative techniques, often non-surgical as well as surgical, to treat benign esophageal disease. Most of the time, these patients will be diagnosed by their gastroenterologist, referred here for an approach which involves a minimally invasive operation with a length of stay that's 1 to 2 days and return to really a high quality of life within several days after surgery.
We want to make sure that their patient experience is as good as it can be, not only medically, but from a personal interaction between them and all staff in the hospital and the medical school. They will receive that care with a degree of compassion and empathy that we believe distinguishes us from many other places.